Welcome to this masterclass to help you adapt and apply the Readiness Assessment Framework. This video will outline what the Readiness Assessment Framework is, explain the practical process for applying the framework, and offer tips to help you overcome challenges in applying the framework. Why a framework? Rapid developments in medical research mean that many new treatments and diagnostics are on the verge of becoming available. However, integrating these innovative approaches into care takes time and careful planning. We have developed the Readiness Assessment Framework to find out how prepared a health system is to integrate a new therapy or diagnostic tool. The framework was originally developed for radioligand therapy, a targeted approach to treating certain types of cancer, and we are now exploring the process of applying the framework to other areas. We would like to invite you to adapt this framework and apply it to your own country, region, city, hospital, or clinic. What is the framework? The framework allows us to understand what a health system needs to do to be ready to integrate a new therapy or diagnostic tool across 5 domains of the health system: governance, regulation and reimbursement, identified need, service provision, and health information. Each domain is organized into subdomains, with specific questions that allow for both quantitative and qualitative data collection. We have applied the Radioligand Therapy Readiness Assessment Framework in the UK.
Through applying the Radioligand Therapy Readiness Assessment Framework, we have gained an understanding of what barriers there are to the health system being ready for these new therapies in the UK. We are using these findings to help ensure equitable access to this exciting new way of treating cancer.
When and where to apply the framework. The Readiness Assessment Framework can be adapted and applied to many different types of medical intervention. You could adapt and apply the framework while looking at your country as a whole, or at a specific hospital or clinic, and anything in between. How to apply the framework. Regardless of the context, there are 4 steps to applying the framework: prepare, research, validate, and prioritize. When you prepare to apply the framework, you should convene a multidisciplinary, expert advisory group and research team. The advisory group is key to this project. Its members will help you guide and validate your research, and you should include representatives from all relevant stakeholder groups. We have developed a stakeholder map template to help you identify potential members of the expert group. You should clarify each member's roles and responsibilities, and you should identify a time frame for performing the assessment and confirm whether you plan to apply the entire framework or just one domain. Once the preparation is complete, you can begin to practically apply the framework. First, you must adapt the framework for your context. This means adapting it to your health system and ensuring the terminology and questions are all appropriate, and validating this adapted framework with the advisory group. Once the framework has been adapted, you can begin conducting research. Explore peer review and grade literature, policy documents, expert interviews, and other sources of information to answer the questions in the framework. This research is the foundation of the framework application. We've developed 2 templates to help you. The search strategy template, which can be used to help identify relevant written research, and the discussion guide template, which can help you develop questions to ask experts during interviews. Use this research to formulate responses to each framework question. You may want to use the working paper template to help you structure your responses.
Next, it is important to ensure that all findings are validated. To do this, seek and incorporate feedback from the advisory group, conducting more research to answer any of their questions. To ensure your research has an impact, you need to plan and prepare. Work with the advisory group to identify the most pressing and important barriers. You may wish to use the Policy Action Blueprint development template to help with this process. Consider who needs to see this material for it to have the most impact. Work with your advisory group to plan the most appropriate ways to engage with these individuals or organizations, and then enact this plan.
You may experience some challenges while applying the framework. For example, you may struggle to identify people to participate in your advisory group. Consider members of relevant professional organisations and patient groups, authors of peer-reviewed literature, and asking your contacts for personal recommendations. You may struggle to find information to answer the framework questions. In this case, your advisory group may be able to recommend relevant literature. Gaps could be filled through expert interviews. But it is worth acknowledging that some data simply don't exist, and that in itself is an important barrier. You may be unsure of how to develop policy recommendations. Think about what created a particular barrier to readiness. Ask what could be done to overcome this barrier. And consider who in the health system is responsible for making change. We hope this video has inspired you to adapt the readiness assessment framework and use it in your own region or setting. For more information about how to apply the framework, including a downloadable copy of the readiness assessment framework, the original framework for radioligand therapy, and templates for your research, please visit healthsystemreadiness.com. If you have any questions about applying the framework, please get in touch.